What's up everyone, Steve here, your favorite physical therapist. What we're going to do today is go over 5 ways that you can best prepare for an upcoming total knee replacement surgery. This video is not meant to be specific medical advice. It is just a list of things that I believe you should do to best prepare for the surgery based upon my 14 years of experience working with total knee replacement patients. Ideally, this video is for someone that is 2 to 10 weeks prior to the total knee replacement surgery. However, it can be for anyone that's considering the surgery and thinking about ways to best prepare for the upcoming operation. Number 1 is knee range of motion, knee flexion and knee extension. Going into the surgery, you want to maximize your ability to bend and straighten. It is high. However, the maximum range of motion that you achieve after a surgery is probably with what you're going in there with. Most people struggle with one or the other. They either have difficulty bending it, but they can straighten it, or the opposite, they can straighten it, but they can't bend it. After that, the second most important thing is maximizing the strength of your knee. Now, the 2 main things that you're going to want to maximize strength of are your quadricep muscle. So that is the large muscle on the front part of your leg, your quad. And then also your calf muscle. Yes, we would want to improve hamstring, although I don't actually have it listed here because there's other things that you probably will want to work on. After that, it's going to be preparing for the logistical situation that you are finding yourself in. So there's 2 main branches of the logistical issues you're going to deal with. One of them is going to be equipment. The other one's going to be situational. When it comes to equipment, you might ask yourself, what kind of walker am I going to use? Where am I going to take a shower? Maybe I might want to consider purchasing one of those little lifting straps that helps me lift my leg up when I get in and out of bed. When it comes to things like situational logistics, might be something like housing, where you're going to live. Maybe you stay with a family member. Maybe a family member comes to stay with you. You also might want to consider where it is you're going to sleep, especially if you have a lot of stairs that you must go up or go down the stairs to get to your bedroom. Other things like your meals. Do you have someone that's going to be able to bring you some food? Are you going to cook your own food? And then lastly, pets. I've seen quite a few people fall because of their pets. So what you don't want to have happen is fall, injure yourself because of your dogs. If you need to, maybe find a family member that can watch them for a little bit, depending on your living situation. Number 4 is going to be improving your overall whole body strength, particularly your back and your arm strength. Because you're going to have a weak leg, you're not going to be able to go sit to stand as easily. Having stronger arms and a stronger back will make it easier for you to pull yourself up, push yourself out of a chair, or even catch yourself if you're going to lose your balance. And then also, this sounds fancy, but I put on there maximizing your contralateral hip flexor strength. That's a fancy way of saying you want to improve your ability to raise your hip up on the same side as the surgery. That will allow you to lift that leg up when you get in and out of bed. And lastly, what I like to do is have my clients wear a pedometer prior to their knee surgery. This really allows patients to have more concrete and accurate goal setting. If you know that you want to get back to work, and to get back to work, you have to walk approximately 4,000, 5,000 steps in a day. Well, you can track that throughout your surgery. And when you get home from the surgery, maybe you're only walking 300 to 500 steps in a day. Well, if you know that, hey, I need those 3,000 or 5,000 steps, or maybe 8,000, depending on your job or your work, that allows you to get more concrete, and you know where you are regarding your rehab and throughout your rehabilitation process. So wearing a pedometer prior to your knee replacement is a really, really great idea, especially if you have return to work goals. Not 100% necessary for everyone, but again, I put it on here because it's something to keep track of. So going over some practical applications of working on the top 5. Number 1, like I said, was range of motion. And the first aspect of that is knee extension. To improve knee extension, it's pretty simple. It's just going to take some time. And what I like to do is have people do a simple heel prop exercise or stretch. And that's just sitting in a chair, placing another chair or a bench or stool or any object in front of you, and allowing gravity to do the work. What I typically will have my clients do is set a timer. They'll get their phone, a running clock for 5 minutes or up to 10 minutes, and just do what you can during those 5 or 10 minutes of a running clock. If you need to take a rest break, you can set it down for 30 or 45 seconds if you need to, and then go ahead and put your leg back up, letting gravity just do most of the work for you. What you can also do is, if you have any ankle weights, you could place that on your knee here. Allow the additional force of the weight to help stretch out your knee. You can also activate this quadricep muscle, and that can help to straighten out your leg, and also work on pulling up your toes towards your nose during this exercise. So again, set a running clock about 5 or 10 minutes, doing as much as you can tolerate in that 5 or 10 minutes, working on straightening your leg all the way out. So that's knee extension. Number 2 is knee flexion, right? So that's the ability to bend your knee. For improving knee flexion, I have 3 main exercises that I go to depending on where you are in your limitations of knee flexion. The first one for knee flexion is if you are unable to bend your knee much beyond 95 or 100 degrees. So if we're going by measurement here, right, this is about a 90-degree angle. So if you're unable to get much beyond that, then this first exercise works really well. And that is simply a chair slide. Sitting at a chair, what I'll have you do is use the other leg. Let's say our left knee is the knee that we're working on here. Here's my right knee. I will use my right leg to push my left leg back as much as I can tolerate. And then if I want to, I could even scoot over. And that can help me get to a maximum knee stretch. Similar thing, set a timer for about 5 or 10 minutes, doing as much of this as you can. Most people with this knee slide tend to do about 30 seconds on, 30 seconds off. That seems to work really, really well. That's if you're between 0 and about 95, 100 degrees. For someone that's between 90, 95 degrees and about 120 degrees, what I'll typically have them do is go to a stair or a step. So in this instance, we're gonna use these weights. But what I like to have people do, placing the knee that needs to improve range of motion on, there's usually a railing or something to hold on to. You're just gonna rock back and forth, and you can kind of hold that position. You can come back. Again, setting a timer for about 5 to 10 minutes and just working on range of motion here. You can play around with different width levels of your feet. This allows you to get a little bit lower. Again, working on improving that knee bending there, that knee flexion. This tends to work to about 120 degrees. Beyond 120, even if you go up multiple stairs and you have a really high step, it becomes rather difficult. So for anyone who is looking to improve their knee flexion beyond 120 plus, the simplest way to do that is in any chair or if you're lying in bed, you're in a recliner, simply pulling that heel towards your buttock. You can use a belt if you need to, really working on bending that knee. For the three main knee exercises are the chair slide, I call it a stair slide, and then a standard heel slide, right, which is pulling that heel up towards your butt. One of those 3 is gonna match wherever you are throughout your range of motion. Pick the one that best suits you and that you feel the biggest stretch on, particularly in that quadricep muscle, and set a timer for about 5 to 10 minutes and go ahead and work through doing as much as you can tolerate in that 5 or 10 minutes. Number 2 on the list is improving knee strength. Now this can be very difficult because the reason most people are having a knee surgery in the first place is that they're in a lot of pain. That's the whole reason for the surgery in the first place. An exercise that most people tend to tolerate well, an isometric exercise. That means the muscle is not changing length, it's just holding a position during the muscle contraction. What I like to have people do is actually in a door frame, and you'll see why here in a second, because it's actually the safest area to do this, is to perform a standard wall sit. So here, I got a closet here at my house, and what I'm able to do is lean up against the door frame, keeping my upper back nice and tall, my mid back against the door frame, again upper back, and all I'm gonna do is lower my level to whatever I can tolerate. You will feel the tension in your knees, and you're just gonna hold this position. I like to have people do about 30 seconds on, 30 seconds off. but you can lower your level. The lower you go, the more tension that you're actually gonna feel in those legs. Now, the reason why I like door frames is that if I feel myself getting stuck and going down, I can grab the trim on the opposite side of the wall. So coming on here, doing about a 30-second hold. If I want to improve calf strength, I can even come up on my toes. Again, an isometric hold in those calf muscles. It's a good way to improve knee strength and calf strength that most people will tend to tolerate. Not everyone, but most people tend to tolerate this pretty well. So we've done a deep review on items 1 and 2, which are strength training and range of motion. For items 3, 4, and 5, I'm not going to go super in detail for sake of time on this video. What I did want to review when it comes to item number 3 and looking at logistics, one of the most important things for you to pay attention to and focus on would be what exactly is your surgeon's protocol for showering and bathing. Depending upon how they close your incision, that's going to alter what you're able to do regarding getting your knee wet. Reviewing that with your surgeon, that's going to help you have a protocol for bathing and exactly how you're going to handle that. When it comes to item number 4, which is improving general whole body strength, upper body strength, your back strength, and the ipsilateral hip strength, that's going to vary from person to person. So many people are going to have, potential upper body ailments, shoulder, rotator cuff issues. But in general, you're going to want to work on your ability to push and pull. That is going to be what will help you improve your overall gross upper body strength. And then number 5, mention the pedometer. Again, just it's a great tool to help you know where you need to get to. So I hope you found this video helpful. If you did, check out the link below. There's a full guide that you can download, and it'll have the PDF and all the information down there below. Hope you enjoyed it. Have a good day.